Apotemnophilia, also referred to as body integrity identity disorder, is marked by an intense and persistent desire to amputate healthy limbs or other body parts. Although the condition is not fully understood, it is thought to have a neurological basis, with some research suggesting a link to abnormalities in the right parietal lobe of the brain. Individuals with apotemnophilia may go so far as to injure a limb in order to necessitate medical amputation. Treating the disorder is particularly difficult because many affected individuals do not seek help. However, when treatment is pursued, approaches such as cognitive behavioral therapy and aversion therapy may be used in an attempt to manage the condition. Alien hand syndrome is a rare neurological condition in which a person perceives one of their hands as having a will of its own. Although sensation in the hand remains intact, the individual feels that the limb acts independently and is no longer under their control. People with this condition often describe the affected hand as if it were a separate being, sometimes even assigning it its own personality or intentions. Meanwhile, the unaffected hand functions normally under conscious control. This syndrome is most commonly associated with damage to the corpus callosum, the structure that connects the brain's two hemispheres. It can also result from a stroke or injury to the parietal lobe. In such cases, the hands may appear to work against each other, a phenomenon known as intermanual conflict, or a form of ideomotor apraxia, where involuntary movements oppose the person's intended actions. Capgras syndrome, named after French psychiatrist Joseph Capgras, who studied the illusion of doubles, is a psychological condition in which a person believes that someone close to them, typically a spouse, family member, or friend, has been replaced by an identical imposter. This delusion is most commonly seen in individuals with schizophrenia, dementia, epilepsy, or following a traumatic brain injury. Treatment generally focuses on addressing the underlying condition and may involve the use of antipsychotic medications, along with other therapeutic strategies tailored to the primary diagnosis. Alice in Wonderland syndrome, AIWS, also known as Todd syndrome, is a neurological disorder that causes distortions in perception related to body image, time, and space. Individuals with AIWS may experience hallucinations, sensory distortions, and a changed sense of movement or speed. The most common symptom is a distorted body image. People may feel uncertain or confused about the size and shape of parts of their body. These perceptual changes can be deeply unsettling, often triggering fear or panic. AIWS is frequently linked to conditions such as migraines, brain tumours, or the use of certain drugs, and it most commonly affects children between the ages of 5 and 10. Dissociative identity disorder, previously referred to as multiple personality disorder, involves the presence of two or more distinct identities or personality states that alternately take control of an individual's behaviour. Each identity has its own characteristics, memories, and sometimes even a different voice or mannerisms. This identity disorder is most commonly associated with severe trauma in early childhood, prompting the mind to develop alternate identities as a way to cope with overwhelming stress or abuse. Common symptoms include sudden shifts in personality or behaviour. There could also be gaps in memory or unexplained blackouts. Also scarily, a sense of detachment from oneself or from reality. Be sure to tap the subscribe so that you don't miss the next episode.